Now, there are certain traits that you as a nursing assistant should endeavor to cultivate if you don't have it, or if you do, try and be better at it. So, some of these are being compassionate. Now, what exactly does that mean, being compassionate? It just means treating people with empathy or sympathy. Sometimes people struggle with this empathy, sympathy. What is it? Now, empathy is identifying with someone's feelings. And then sympathy just means that you actually know how that person feels. Let me use, this is a very sensitive subject for a lot of women, and that's why I'm coming up with this. Now, and I have used this in class before, so I'm okay. As a woman, sometimes we go through certain things that is very hard for us, like miscarriage. Now, that's something I have personally experienced. So for someone who's not experienced that, so saying that let's just imagine I have a patient now. I'm caring for a woman who's had a miscarriage. I can totally sympathize with her because I get it. I know what she's going through because I've been through that myself. So I sympathize with her. Now, for instance, if I've never been in that situation, then I can empathize. I can imagine how that feeling, how excruciating that pain that she's going through might be for her. So hopefully sharing my personal experience helps you with that. That's one instance. It could also be nursing school. Okay, someone going through nursing school. Oh my God, nursing school, yes. So I've been through nursing school and I know that it's a lot of hard work. It's a lot of dedication and it's a lot of schoolwork, having to do that and also work. And I did that. So if I'm talking to a nursing student, I can totally sympathize because I get it. I know what it is to have to juggle. I know what it is to have to put up with certain things that you normally probably wouldn't have. It's just part of nursing school. It's like getting in the trenches and just doing what you have to do. Now, for someone who hasn't been through nursing school, but they understand or they can imagine that school work, and especially maybe for an accelerated program, they have also been through some kind of accelerated program or some kind of education where it was also a lot of work. They can empathize with you. So hopefully this helps you. I was just trying to give you an example of being empathetic and being sympathetic. So when you're compassionate, you show these two qualities. Another thing is being honest. I mean, seriously, even if you're not a nursing assistant, honesty goes a long way. You always want to tell the truth. You always want to do the right thing. Basically, that's what it is. Just being honest. You're not going to be lying. I tell people that if you have to lie, just keep quiet, be silent. Because you get caught in a lie. What's the point? Why? You don't need that. So be honest with your residents and also your colleagues, the people you work with. If you haven't done a skill or you have not done a task, do not chart, do not document it. If you haven't done a treatment, and this is not just, not for nursing assistants, anyone in the healthcare field, then please do not document that you did. You have to be careful with those things. Another character you must have as a nursing assistant, it would be helpful for you to have it. It makes the place a better place for you, believe me. Tactful. Tactful essentially just means you being sensitive. You got to be sensitive. You've got to have a filter when you're talking or when you're, conversing with people. You've got to be tactful. You've got to have a filter. You have to be very sensitive to people's feelings. You have to be able to read facial expressions and just don't blurt the first thing that comes in your mind out. You got to be pragmatic. Now, pragmatic to some people, and sometimes I think so too, just means not telling the truth. Well, it just means being diplomatic, that you just have to be sensitive to people's feelings. So that's how I see it, tactful. And then dependable. Please be dependable. If you say you're going to do something, do it. Let people, if you're supposed to be on time, work, they give you a task and there's a specified amount of time you have to do that task, then go ahead and do it. Be known as that dependable person. I cannot, oh my God, I cannot tell you what a wonderful thing it is to have a dependable aide. Oh my God. It's a blessing, and vice versa. And I'm sure there are aides that just really, really also appreciate a dependable nurse. Teamwork works, people. Teamwork works. Another trait that will be helpful to have is being respectful. You got to be respectful of people. The populace or the population of people you be dealing with, for one thing, a lot of them are older than you. Now, that's not to say some are not younger than you. But then in the nursing home, you find they're older people. And they're old school. They've been raised a certain way where people do not blurt out people's first names. And this is aside from nursing, the nursing world and the healthcare world, is actually a personal pet peeve of mine. I'm a very respectful person, and I usually tend not to address people by their first names. I will go by Mr. or Miss or Mrs. or Sir and Ma'am. Please do not address people by their first names. Or even the worst of them all is when you do that whole honey, dearie, sweetheart. For me, that's very demeaning, it's very patronizing, and it actually is very disrespectful. Please do not do things like that. That is not professional. Call them by what they want to be called. If they want you calling them honey, then by all means call them honey. But they're not your honey if they haven't given you permission to do so. So please do not be very presumptuous. That is not being professional. Now, another thing is you cannot be prejudiced. You're going to take care of people from different walks of life, different religion, different food preferences, different sexual orientation, different everything different from you. So whatever your preconceived notions are, drop them in your car or in the bus or in a friend's car that brought you, and don't come into the building with it or into their private homes. You cannot be prejudiced. That is not your place to judge anyone. You're not better than anyone. There is a sense of self-worth and a sense of self-esteem, high self-esteem, and that's fine. There's nothing wrong with that. That's not what I'm saying. I'm just saying do not patronize people. Do not talk down to people. Do not think that you're better than them. Probably because you've had this education and so you do know some amount of nursing care, and they don't. They're the lay person. But do not talk down to people. You've got to be very, 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 very cognizant of this. That is not being professional. And then, of course, being tolerant. You're going to, again, tolerant. You're going to meet people who don't agree with you. Your job is to provide care. It's not to judge them. It's not to argue with them or interrupt them or correct them. You're not supposed to do those things. So please do not. So these are nice traits to have. Your book talks about them, so I thought I should also mention them. And these are good traits. When you have them, it helps you. It goes a long way. Whether you're working or even in school. Everybody loves a respectful person. I do. Everybody loves a person who is dependable. I love that. It helps. It helps to be dependable. I'm a dependable person. My word is my bond. If I give you a promise, I do whatever it takes to make sure I keep my promise. So I like to think I'm dependable. I'm a caring person. I care what happens to people around me, not just my students. My students can attest to this. But even where I work, it's just something, it's just one of my virtues, things that I believe in. It's my value system.